lay on your belly, watch TV on your belly, sleep on your belly, and push
Oh,
the
really?
electric. Yeah. If you don't like Gatorade, I'm telling them drink Pedialyte, cup an hour. Just keep pushing the fluids. I've gotten half dozen people through it that way.
Oh, go home, lay on your belly, TV on your belly, sleep on your belly.
Yep, everything on your belly. Prone makes a big difference.
If you don't like Gatorade, I'm telling you drink Pedialyte, cup an hour. Just keep pushing the fluids.
Yes.
Half dozen people through it that way. Oh,
I got one friend that took 6 weeks before he finally tested negative.
Yep, everything on your belly. Prone makes a big difference. You don't
Big difference. And it's simple to do.
Dr. Brown, are you prescribing any medications for these people at all?
I have on a few given them some Zithromax just for fear of secondary pneumonias. Shot of Rocephin Zithromax because I'm fearful that they've already, by x-ray, were showing pneumonias. So I'm treating the bacterial pneumonia, not the virus.
Yeah.
Any steroids or?
I haven't had to do that. I'm kind of holding off. That's more inpatient stuff.
Okay.
But if the reason they get their steroids. Actually, it is pretty outside.
Yeah, it's beautiful.
Hot.
It's not that bad in the shade.
Did I mention it's hot? Guess who does not like hot weather? It's terrible.
Got it right there. You rascal. I'm gonna pour it all afternoon.
But hey, it might be a good night for comet viewing.
Yeah.
How you doing, Rob?
Hanging in there.
Dr. Snipes, I came out and parked on your street the other night to try to see the comet. Don't let anybody arrest me.
We called the police, that was for sure.
Well, I'm in Randolph County, so I'm always worried about guns, but I went up to the top of the hill and then I inched down and I'd get out and I'd look and look and look. And
Did you see the comet?
I did not. Not that I could tell. I saw some things that could be, they say the tail is not as clearly defined, but tonight, this week, the viewing is supposed to be optimum. So
What direction? What direction?
Big Dipper, the northwestern sky.
You could probably come to my house and look on the back porch. We see High Point, Winston. So you could look out that way because we see northwest.
Oh, I was out there about 10:30 one night up and down that road up to the top of the hill and back.
Aren't they saying best about 3 a.m?
Well, I wasn't looking
Don't
at
come in. If you come at 3, you might get shot.
Yeah, exactly. I might get shot at 10 or 10:30.
You might.
All right, guys, we ready?
We're ready.
Okay, at this time, I'll call the July 13, 2020 Board of Health meeting to order. So, Brooke, are you aware of any public comments? So we have no public comments. We'll move on down to the approval of the minutes for May the 11th. Hopefully you've had a time to review those. Do I hear a motion to approve the minutes as presented for May the 11th?
I move to approve the minutes as presented.
I second the motion.
Okay,
So I, Robert Brown, approved.
Aye, Courtney Austin Wilson, second.
Okay, Mary Ann, how do you vote?
Sorry, approve.
Carrie?
Affirmative.
Hope?
Approve.
Julie?
Approve.
Lynn? Yes. Brian,
Approve.
Mac,
Approve.
Amy,
Approve.
and I, Marty Trotter, approve also. And now let me back up. We do need to do an attendance, and I'm sorry for that. So if you'll state your name and just say present. So we'll start with Courtney, if you don't mind.
Aye. Courtney Austin Wilson, present.
Okay, Robert,
I, Robert Lee Brown, present.
Mary Ann,
Mary Ann Evans, present.
Carrie,
Carrie Hampton, present.
Julie,
Julie May, present.
Lynn,
Present.
Ryan,
Ryan Snipes, present.
Mac,
Max Summy, present.
Amy,
Amy Williams, present.
Hope.
Present.
You state your full name.
Oh, Hope Haywood, present.
That's
Sorry.
fine. You're fine. And Marty Trotter, I'm present. So sorry about that, and thank you. At this time, we'll turn it over to Susan Hayes for the central permitting refund policy.
Okay, at first I want to apologize that we sent out a ton of emails to y'all today, but we've been a little bit crazy lately. And anyway, so I apologize. We'll try to do better in the future. We have been, as a county, looking at our central permitting ordinance for several months, many months. I don't even know how many. And they finally have gotten a draft proposal together. And so what you would have received was that draft. And essentially what it is doing is just updating the central permitting ordinance to reflect our current business practices. Environmental health is a part of central permitting. And what we've also been able to do in this process is they are making permits available online. So electronically, you can go in with central permitting, certain permits, and request a permit online. We're not to that point yet with environmental health. I'm looking at Michael Rowland, our department head for IT, because he's here. But we're not at that point with EH yet, but we will hope to be at some point. We've had a policy about how we refund permits when people request refunds, but we're trying to make this one cohesive piece. So our proposal is to roll that permitting refund policy in with central permittings, which is a part of the ordinance that you received. Our old policy, or the policy we currently have under environmental health, is that we refund 100% of what the request is. Sound like I'm from the South, the request. Anyways, the new proposed policy, which is normal, I mean, it's the usual policy for central permitting, it would be new or revised for us, is to withhold administrative fee. So they don't get all of it back, they get most of it back. It's the administrative fee will be $10 or 25% of the permit fee, whichever is greater, up to a maximum of $75. So sometimes, and the reason for this, I think on our account, sometimes some work has been done. So we may have gone out and looked at the property, and all of a sudden something happens and the property owner says, you know, I'm not going to get to do that after all. Can I have my money back? And we do grant those requests. So I think the thought in why central permitting, and this is like building inspections, they will have gone out and done some work, and then somebody will request a refund. So oftentimes there's work that has been done that we're not getting paid for if we don't charge an administrative administrative fee. So our request to you tonight is to revise our environmental health, and this is for soil and water. Food and lodging is not a part of this. So it would be for soil and water to roll our refund fee to accept the Randolph County Central Permitting Ordinance that will be approved in August, we hope, by the commissioners at their meeting. We would adopt the same refund fee for environmental health, on-site waste and water. So we're asking for, I guess the motion would be to adopt the central permitting ordinance, county ordinance refund policy for environmental health. Does that make sense?
Can you repeat that last part that you?
Yeah, so the motion I'm
last part
asking,
again.
the motion I'm asking, or the approval I'm asking, would be to adopt the Randolph County Central Permitting Ordinance refund policy for environmental health, on-site wastewater and wells.
Okay, you've heard Susan's presentation on this. Do I hear a motion to adopt the Randolph County Central Permitting Ordinance refund policy for environmental health?
This is Hope Haywood. I would make that motion.
Okay,
I would second. This is Robert L. Brown. I will second that.
Okay. All right, we have a motion and a second. Any discussion? Okay, we'll go through the list. Courtney, on this particular motion, how do you vote?
Aye.
Robert, you made the second. I guess you need to vote again. I'm sorry.
Aye.
Mary Ann?
Aye.
Carrie?
Carrie Hampton, aye.
Hope?
Hope, aye.
Julie?
Julie, aye.
Lynn?
Aye.
Ryan?
Aye.
Mac?
Aye.
Amy?
Aye.
And I'm Marty Trotter, vote aye as well. So motion carries. Next item on the agenda is the dental clinic eligibility policy.
So you should have gotten, and I'm going to try to make this simple, should have gotten two policies, our current policy and our recommended policy. The current policy, the eligibility population is preschool through school-age children, and that we would provide emergency treatment for adults. Right now, we do a sliding fee scale. It is based, it goes up to 200% of poverty. We have a $30 per visit flat fee for everybody. It's like an office visit fee. But if you elect to have a special service, that flat fee is $100 per person. And then if you don't have health choice or Medicaid or dental insurances, then we would calculate your fee based on that sliding fee scale and your income. So you might be, you know, zero pay, whatever, 20%, 40% on up. That's our current policy. Our requested approval, our requested policy is that we add school-age children, preschool through school-age children up to age 21, low-income pregnant women, and then emergency treatment for adults. So we're adding individuals up to age 21. Oftentimes when we work with folks that we've seen forever, since they were little, when they get 18, they don't want to leave us. And so we are requesting that up to age 21. And then we would like to add low-income pregnant women in there because dental health, oral health is so important for pregnant women. And it can be extremely important whether or not a pregnant woman has a healthy pregnancy outcome. And so we'd like to be able to offer that for low-income pregnant women. So that's the first part of it. And then the second part is that we added a definition about pregnant clients and their eligibility guidelines. So, you know, if they have certain things, and I can read it to you, that they're pregnant, we know they're pregnant, they don't have a dental home and or have pain or concern about their oral health. We see them their first trimester for education only. Then we schedule for treatment, cleanings, x-rays when they're in their second trimester, given that they have medical clearance from their OBGYN. So we've added that definition. And then when we come down to the fee schedule part, again, it's the same thing, $30 per visit, $100 if you're doing an elective special procedure. But we want to lower, instead of sliding the sliding fee scale all the way down to 0%, we would like it to only slide to 10%. And part of that is dental costs are going up. It is very hard to, you almost cannot find dentists who want to do public health because we cannot pay people what they can make in private practice. And so when we have somebody who comes in who's zero pay, they essentially get any service we offer them for $30. And that is almost not practical. It's not almost, it's not. We can't do that and continue to offer dental services. Our dentist is highly qualified. She is a doctor of medical dentistry, and she is excellent. She does a fabulous job. She has gotten several grants already, and right now we are in a loop. We've got a conference call set up in August for a Duke Endowment grant that she's written. So she's working really hard, and I don't think these are unreasonable requests that she's made. So we are asking that you approve this eligibility policy with those changes.
Susan, there was one more change too, wasn't there? In the eligibility financially, it went from 0 to 60 days prior to 0 to 30.
Thank you, Dr. Brown. It did, and actually that was a typo. It should have been 30 all along.
Okay.
So thank you for catching that.
All right.
Okay, anything else?
Not on that.
Okay, we have heard from Susan on the dental clinic eligibility policy. Do I hear a motion to approve the policy revision as presented?
I have a question.
Go ahead.
Okay. On the policy statement, the low-income pregnant women with an asterisk, what is the asterisk referring to?
That's a good question, Mary Ann. I think what she meant, we probably just need to take that out. Because she didn't asterisk she was trying to refer it to that definition. So we probably just need to remove that asterisk, or either asterisk by the definition.
Okay, that's what I figured.
Yeah, thank you. I know I'm hollering. I guess they could hear me if I don't holler.
Take that out or remove that asterisk?
I think we'll add the asterisk, and that way if somebody's not sure what we're talking about, they'll know to look there.
Okay. So what we're going to do, thanks Mary Ann for asking that question, we're going to add the asterisk over to the definition on page 2 under that section called Pregnant Clients Additional Eligibility Guidelines. We'll add that asterisk there. So with that, do I hear a motion to approve the policy revisions as presented?
I, Carrie Hampton, move to approve the policy revisions as presented by Susan Hayes.
Okay, have a motion from Carrie. Do I hear a second?
I, Robert L. Brown, second.
Okay, have a motion and a second. Any discussion? Okay, we'll go through the list. Courtney, how do you vote on this motion?
Aye.
Robert?
I, Robert L. Brown, vote aye.
Mary Ann?
Aye.
Carrie?
Carrie Hampton, aye.
Hope?
Hope Haywood, aye.
Julie?
Julie, aye.
Lynn?
Aye.
Ryan?
Ryan Snipes, aye.
Mac?
Mac Summy, aye.
Amy?
Aye.
And Marty Trotter, aye. So motion carries. Now moving on down to the agenda, we'll look at the 2020-2021 clinical fee revisions. And again, Susan.
So, North Carolina Medicaid has temporarily enhanced many reimbursement rates to support delivery of Medicaid services. And those enhanced rates that they have right now, there's certain ones, not all of them have been increased, but several. And they will be effective through September 30th. My understanding is that they are looking at these rates all the time. Originally, they had made them effective through June 30th, and then last week they increased that effectiveness through September 30th. In the beginning, we didn't make any changes because they weren't that far off, but since we've submitted our fees to the commissioners, because those always go in with our proposed budget and they were approved with our budget, we have decided that it would be to our advantage as an agency to increase or whatever. I think we increased all, I know we did. We increased these fees for now. Now right now, as far as we know, they won't be effective after September 30th. These are fees that we do a fair number of. The ones that we don't really do that many of, we left alone. We didn't change them or ask for you to change them. So the ones that you have, and these are like established nurse visits. The nurse meets with a client for 5 minutes. We do a lot of those. And there was like a $20 difference in that fee, what we had now and what this fee was for coronavirus issues. Well, during the coronavirus time, it's not just for those issues. Same thing with the, well, it was actually a $30 difference. You can see our current fee is $40 and they're going to pay more, so we need to increase that. The other part of that, if you'll remember, and some of you will and some of you won't, because it took me forever to understand how it works, we get cost settled for our fees for Medicaid. And the reason we do that is they don't reimburse us exactly the same as they do other providers. And so in order for us to get our cost, at the end of each year, we file for settlement on those costs, and then they'll pay us a portion of that. If we don't change these because we do a number of them, then we'll lose money on the backside. So that is why we've increased these fees, and there was only one that was related to the dental clinic. All the others were the family planning and CD clinic. And the dental fee, Dr. Mustafa received a grant for teledentistry software. She is working on getting that implemented. And so we need to be able to charge for those encounters. And hopefully that will be going before long. So that is, does anybody have questions? I mean, can you see these fees? Have you been able to look at them? Okay.
Susan, I have a question.
Yes.
Is this fee increase simply for Medicaid? Do you have any patients who pay out of pocket, and would this affect them?
It could affect them, but remember, very few of our clients come that are 100% pay. So again, if you're zero pay, and I'd say the vast majority of people we see are zero pay, they're going to pay nothing to come see us. Or they may pay 20% or 40% and so on. So I would say it would be very rare for somebody to have to pay the full amount. And if they do, they're doing it because they like coming here, not because, you know, they can't go somewhere else. And we encourage people, if they've got insurance or even Medicaid, we say, you know, there are providers in town who can see you for this. They will take you can have but a lot of our family planners in particular like coming here. And part of that has to do with the way we provide their birth control. It's cheaper for them to come here because we can get birth control through 340B pricing, and that's better for them than you know, going to a provider. So that's a good question. Thank you, Mary Ann.
Any other questions?
Susan, you mentioned these fees were effective through September. So at the top of the document, it's got rates effective from August 3rd to June 30th, 2021. Is that still correct?
No, that won't be. I think she probably did that in case they decided to extend it.
Okay.
But North Carolina Medicaid right now has only said these are effective through September 30th. So they're not going to pay us that rate, that, you know, unless they extend it. So
I just want to make sure you didn't.
She did that, but thank you, Lynn. I'll ask and make sure.
Okay.
Okay, any other questions? All right, do I hear a motion to approve the fees as presented?
I, Robert Brown, move to approve the fees as presented.
Okay, do I hear a second?
I
second.
I didn't catch.
This was Lynn, but whoever else spoke.
Okay, Lynn, thank you. This time I'll go through the list. Courtney, how do you vote on this motion?
Courtney Austin Wilson, aye.
Robert?
Robert Lee Brown, aye.
Mary Ann?
Aye.
Carrie?
Carrie Hampton, aye.
Hope?
Hope Haywood, aye.
Julie?
Julie May, aye.
Lynn? Ryan?
Aye.
Mac?
Aye.
Amy?
Aye.
I'm Marty Trotter, aye. So motion carries. Moving on, the final item, we'll turn it back over to Susan for the health director's report.
So this is going to be the Susan and Tara show. I'm going to start with a couple of things and then I'll probably turn it over to Tara. First of all, I want to thank y'all for our lunch and all the goodies you brought us. They were phenomenal, and we just so much appreciate that. You know, that kind of stuff just brings a light to everybody's eyes. And the folks over here in this part of you know, we're still over at the EOC, but the folks over there, I mean, in here in this building, they were just like little kids that got Christmas or something. We were a little stressed about it all, but they thought it was just the best thing ever. So thank y'all so much for being so thoughtful, and we deeply appreciate y'all's support. Today's totals when we left a while ago were 1,540. We had an increase of 52 positives today. We had another death today, so that brings our deaths up to 32. 33. Excuse
33.
me. Thank you. Tara keeps me straight. And that one was very, very concerning. We've had several like this. It was a person in their early 40s, and they had absolutely no underlying conditions.
In the early what? 30s?
40s.
40s.
Yes. No underlying conditions. Anyways, you know, things are really ramping up. when positive tests are done and if they're doing testing such that it's through a laboratory like LabCorp, those are automatically reported to us through the North Carolina Electronic Disease Surveillance System, or NCS. What's happening now almost is that we're getting so many positives that our staff is having a hard time keeping up. But the other part of that is some of those laboratories are taking so long to report to us that by the time they report it, the person's really almost out of their isolation period. So any contacts they might have had, we've not had the opportunity to adequately quarantine them. So for example, on Friday, we had an individual who it took 9 days for her to get her test results. There's some laboratories that are much better than others. And again, it just is that supply chain issue, supply and demand kind of issue for people getting tested. And so I don't think these things are going to go away. I'm hoping they're going to get better. They're better depending on where you go and what you get. So anyways, just so you know, that is a concern. So that's sort of where we are right now with testing. That's about 1% of our population. You know, if Randolph County's got 145,000 people, we had 1,540 positives today. The national estimates with Johns Hopkins, as Dr. Brown was saying a little bit earlier, is 1 in every 100 people in the United States is positive for coronavirus. And about the population of Randolph County has died nationwide. So about 135,000 have died, and we have about 145,000 in our county residents. So that kind of gives you how to, visual perspective. We are partnering with an entity called CCNC, Community Care of North Carolina, to do contact tracing. That has worked extremely well. They work 24 hours a day, 7 days a week. We had so many positives at one time, all at one time, that the supervisor for those tracers that work for our county, that supervisor pulled in contact tracers from other counties to help, because there were so many contacts to get a hold of. So it's nice to know that they can gauge that volume and pull in help when they need to. And we've just been very, very pleased. So I want you to know that contact tracing is going really well, that the state is set up through Community Care of North Carolina. And so that's that. We've been working with the detention center to try and help them from the beginning, figure out how we can keep coronavirus out of the jail. They've got a census of about 200 and something right now. They had it down to about 170 and maybe even 150 at one time. But we've seen more activity in terms of people being detained. The court system is getting ready to sort of ramp up. So we're trying to hold that number down. There's been a number of people kind of working on that in the periphery with some recommendations that were not particularly good recommendations. Thank goodness we were able to get them steered in a better direction. And so I'm going to let Tara tell you more about that and how that will work in just a minute. I also want to mention that in the EOC, we have Sam Varner is our business liaison. We requested him in particular because he already worked with businesses in a wellness collaborative capacity. He knew a lot of those folks already. It made sense. And we asked Hal if he would appoint him to us. That's worked out beautifully. Tara is a contact for several businesses, as is a couple of our health educators. They have their own businesses that they tend to be contacts for. I've been the primary contact for Randolph County Schools. Dana Wright, our communicable and preparedness nurse, is the primary contact for nursing homes. And she has done an outstanding job with them, because at 12 o'clock tonight, Universal Healthcare, who had an outbreak early on, will be outbreak free if we make it to midnight tonight. So we are just pleased as we can be for them, because they have worked extremely hard. And if you can imagine being in the middle of that in a nursing home, it's not any fun. But they've done an outstanding job. Woodland Hills is struggling a little bit. They are following our recommendations, and eventually we will get them out of this. They will get them out of this, because they are the ones doing the work. Alpine has had a couple of positive staff members. Claps has had a few staff members, but no residents. Excuse me, Alpine's not had residents. Right. Alpine has not had residents. Claps has had 2 residents, but they have recovered. And so we're still working with Claps. They still got how many staff?
Class has 4 staff, 2 residents.
They have 4 staff, 2 residents. So we'll continue to work with them. Everyone else in the county is okay right now. We have 13 nursing homes. So we are, that is fabulous. A lot of times we get questions about, well, your deaths are all about nursing homes. No, they're not. It's about, what, 14 or 15? Yeah, I'm going to say about 14 or 15 deaths can be attributed to nursing homes. The others are not. They're community. Whose dogs are barking?
Mine. Mine 4.
So that's where nursing homes are. Dana's done a great job. April Wilburn, our director of nursing, has been the primary contact for the detention center, and I'm saying she works day and night, 7 days a week, 24 hours a day. They call her. Sometimes they call her, then she calls me, and that's okay. That's what we do. But Tara has also been an asset for them and has worked really closely with the detention center. So Allison, one of our health educators, is the primary contact for day camps and camps. She's worked very closely with them. Who else is doing special stuff?
Kendall is the primary contact for food service that's COVID related.
Kendall Phillips, our other health educator, is the primary contact for education and help for food service. So we've had like Biscuitville, there's been a Taco Bell in Archdale. We've had a lot of questions about Pioneer Restaurant in Archdale. So we get food and lodging involved in all of those. But Kendall is the first stop, and she does, here's what you need to do. Here's the, those kinds of things. So Kendall is doing that. So that's just kind of a quick not quick, but that's an overview of how our EOC is kind of organized. EMS is there every day. They actually, Donovan Davis is when you look at the way incident command goes, he is always the incident commander, but I would be the special, topic, no, that's not the word. What did you use today when you were talking to Effie and you said she's not the subject expert? So we're kind of like the subject experts. So I would be that incident commander for public health. So that's kind of how that works there. EMS has been extremely supportive. They've helped us on a number of things. We also have had to provide food and lodging for some of these folks that have been isolated. DSS has been the feeding coordinator. There's a person there that helps us with that. We provide like last week, I had to go buy, because I wasn't busy, I ran out and got diapers for somebody who's being quarantined or isolated because their infant needed that and they had no one to go get those things. So you have to think about that. When we say to people, you can't leave, you're isolated or you're quarantined, we've got to make sure they have all the things they need. That's public health's responsibility. So that's kind of how we've been operating, just to give you an overview of that. And then one other thing I'm going to tell you about, and then I'm going to turn it over to Tara, is we were notified last week that the state has provided funding for, I need to find my notes or I won't tell you right, community testing in high priority and marginalized populations. They're calling it CHAMP initiative. We were told, well, they target areas in each county that has a significant population that's been affected in a significant way. And they looked at both the African American population and the Latinx population. Randolph County was targeted because we had the spillover from Chatham County with the Mountain Air chicken processing plant, the meat processing plant. So they will be doing free testing in the Ramseur area because of that. I got an email today from Teresa Shackelford with Mercy that they had been contacted about it, but I think because they have to provide medical homes for these people if they don't have them, that's why they contacted Mercy. We were told we would be contacted, but they haven't contacted us. So I think that's the reason in my mind why they didn't contact the health department. And so Teresa and I are going to have a call tomorrow to figure out what's going on with that. I feel like, again, because they're a FQHC, a federally qualified health center, and because they can provide a medical home for people that may not have adequate insurance or resources, that is why they contacted them. So we'll figure that out. So I just wanted you to know that. You'll be hearing more about that probably in the news, and that will be happening over in Ramseur. So Tara's going to tell you about the detention center, and she's going to answer a couple of questions that we received through email from you guys, and I'll let her come take my spot. And then if you have other questions, we want to answer as many as we can.
While she's coming up, I will say that I have noticed more of our Hispanic population wearing masks. So I feel like whatever's being done in the way of education is reaching people.
Yeah, I hope so. We've really been working hard at it. And we've also noticed when you look at our race and ethnicity numbers, in the beginning, well, starting about once that Mountain Air outbreak happened, we saw a tremendous jump in cases in the Latinx population. They are now slowing down, and the rest of us are catching up with them. So they are getting the message, and they're doing better and doing the right things, and those employers for them are doing the right things. Now, we've got an employer right now that we're working with that's not doing the right things, but Sam and I are working with them, and that's Hughes Furniture in Randolph. So we've been working very closely with them, and we're going to get them straightened out. But I'm glad to see that they are getting the message, Hope, and I appreciate you noticing that.
Hey, everybody. Sure miss seeing you guys in person. And I want to echo Susan's sentiment for the goodies that you guys provided a little while back. Everybody was really excited about that, myself included. But before I give you guys an update, Susan gives us kudos all the time, but Susan Hayes is doing an absolutely phenomenal job through this COVID-19 pandemic. There is nobody I would rather work under through this. And I think she takes a lot of heat a lot of the time, and she does not get credit for what she is doing. So I just want to say thank you to her and give her kudos for the work that she's doing. So I am going to provide you guys with a little update on the detention center. Currently at the Randolph County Detention Center, when somebody is brought in to potentially be booked in, they are screened before they are ever allowed to enter the premises. And if anybody answers yes, has a fever, or answers yes to any of the symptoms, then the detention center tries to get them sent out to get them tested. The detention center is beyond capacity, so they're limited where they can put folks. So they're putting folks right on top of each other and moving them within a short amount of time, maybe 4 days. They're moving them into general population once they're booked in. So what we would like for them to be able to do, and what we're working to help them to do, is to get a company. Mako Medical is a company that we've been in touch with that could provide the detention center with testing supplies, which would allow the detention center's medical provider, which is Medico, their staff could test inmates that are being booked into the detention center. And within 24 to 48 hours, they would have test results for those that are just booked in. I think that would give them a better idea of who's got what coming in. They can address any potential positives accordingly. It would also protect detention center staff, those that are transporting inmates to and from court, that kind of thing. Am I missing anything related to that? No. Mako Medical can provide this service for $100 a test. The detention center is averaging booking in 10 inmates per week right now. It's slow season because court system isn't completely underway, and they're trying to keep as many people out of the detention center as possible. But in working with the detention center, it's been determined they're bringing in about 10 inmates a day. So at $100 a test, that's $1,000 a day. So we've proposed to the crisis management team to go enter a contract, the county enter a contract with Mako Medical to provide this service for the detention center. And it's looking promising, and hopefully we can get the ball rolling on that this week. I think that's all I have for that. So cross your fingers that will go through. That would be a huge, huge thing for the detention center, because they've done a tremendous job at keeping it out, and we think that this will help them even more keeping it out of the detention center. I do want to mention that the money that's what it wouldn't come to mind. The testing would be paid for through some money that the county is getting through the CARES Act. The county's getting $4.5 million. So we would be using that money to pay for that testing. Does anybody have questions about that?
We are, and adding that we are also requesting money to do a marketing campaign and retesting.
As part of that CARES Act, every department is has somebody, most departments, I guess I should say, has a representative on the crisis management team, and they're bringing requests for what their departments might need related to COVID, addressing COVID and public health. We are asking for money from the CARES Act to be able to do a marketing campaign. And what was the other you said? It left me that place.
The testing.
We also want to do some testing out in the community as well. We'd like to be able to offer testing to the marginalized populations, maybe up Northtown around the Northgate Shopping Center area, and then somewhere around the mall area, which would get some of the folks kind of that are on the east side. So we would like to be able to request and get some funds to be able to do that.
I'm targeting that because we know more cases, because of zip codes too.
Yeah, and we're targeting those areas because those are the marginalized populations, and we know that those are the folks that need to be tested.
Well, we're seeing more cases in that area. You know what I mean?
Can y'all hear her? We're seeing more cases in those areas, so that's why we're targeting those areas. Good.
Yes. Good job.
Woo. Okay, so I had a couple of questions sent to me via email, and I'm going to do my best to answer them. And if I'm not answering what you've asked, please clarify so that I can answer you to the best of my ability. So one of the questions I got was, how can we be sure that a patient who has more than one COVID test is only counted once? So the process is when there is a positive lab result, the lab or our nurses enter that positive result into the NCED system, which Susan just said, that's the North Carolina Electronic Disease Surveillance System. The cases are unique persons. So when they enter that information, they're entering a name, a date of birth, an address, and a social security if they have that information. And that positive test is assigned to that person. Now, there are some individuals who are getting multiple tests, and anytime they get another test, whether it's negative or positive, it's going back to that particular case. So there's not going to be, so if I'm entered into NCED, I'm going to be in NCED one time. And if I'm positive 2-3 times, I'm going to count as one positive total. Does that make sense? NCED has a mechanism to flag, like if somebody else goes in to try to add another positive, they're going to catch that when that person's information is going to tie it right back to that individual case. There are situations that are coming up now, because we've been in this long enough, that the potential for reinfection is coming up. We actually had one of those today. Those are not counted as a second positive. The situation we had today was somebody was positive a month or so ago. Their symptoms cleared, and they had, I think, at least one negative test, and now they're positive again. They will not be re-entered as a second positive case. Their information will be sent to CDC. They want that information for tracking purposes, but for the state of North Carolina, that is not considered a second case. So of the numbers that Susan gave you earlier, I can't remember how many we have positive.
1,540.
So the 1,540 cases, that's 1,540 people, individual people, it's not duplicated. Does that make sense? All right. So the other question was, if a patient has COVID-19 but dies of another cause, is this counted as a COVID death? And then who makes this determination? I have a screen. Can you share my screen, Ernie? We have some examples, and I hope this will help you understand what could be entered onto a death certificate.
Which document is it?
The far right.
This one?
Yes. If you'll scroll up just a little bit, right there. So this is a section on a death certificate. Where'd it go?
We're not seeing it.
Here. Which one? Is it the one on the right?
It's not there now.
I don't see it. Why would it not show all of them?
There it is.
Okay.
Everybody see it now?
Yes.
Yes.
Better.
This is just a section of that's on a death certificate, and you can see in this situation that the person died, the immediate cause of death was acute pneumonia. And then directly below that, those are underlying conditions. So COVID-19 is listed as a underlying condition that caused the acute pneumonia. So this person is a COVID-19 associated death. Can't read that up there. So if you'll scroll down, I'll show you a situation where an individual has COVID-19 on their death certificate, but it is not, they would not be considered a COVID-19 associated death. It's at the very bottom. Here's an example where the immediate cause was metastatic adeno, I can't say that, Dr. Brown, adenocarcinoma of the lung.
Carcinoma.
Thank you. So this person had lung cancer, but they also, if you look down there in that part 2, other significant conditions contributing to death, but not resulting in the underlying cause given in part 1, they had COVID-19 and emphysema. This situation would not be a COVID-19 associated death. This person was going to die of lung cancer. COVID-19 may have helped them along a little bit, but they died from lung cancer. So that's just an example of how it's determined what's COVID related and not COVID related. And the physician or the medical examiner is the one that makes that call. And I will note, it has to have a positive lab result to go along with it. Good. Questions? Did that answer? I hope that answered the question that was asked.
Quick question. Because it's taking so long for these tests to come back, people are dying, and then they get back the positive report. How is that reported?
If they die before we get the.
If they die before we get the positive?
Yeah.
I don't know. They not symptoms until they got positive. Yes, I don't know.
I don't know the answer to that, Dr. Brown.
Okay.
So
because I don't think we haven't encountered that specifically.
Well,
Okay.
For example, we've had a number of individuals who died in the community. And we've actually had to do coronavirus testing on them post-mortem. So that is what we would do. Now, if we knew they had been tested, then we would track that down. Somebody would track that down to see what that test result was. But we've had a number of people that died at home where we've actually had to go in the morgue, go before they were removed from the house and do the testing. What else?
All right, thank you guys.
Thank you.
Thanks, Tara. Can you put us back on just regular review? Okie dokie. So that is the end of our report for you guys tonight. Do you have any questions about what we're doing or any concerns that we need to address before we finish up?
I have one, Susan, and I know I contacted you today. Is it appropriate, because you know, even as a business owner, is it appropriate to contact the health department, I guess is what I'm asking, to ask the questions like we talked about? It's not if you have somebody, it's like when you have somebody. But I also don't want to do something I'm not supposed to do either. Is it appropriate for a business to contact the health department and ask these questions of what they need to do with these employees or what they need to do with businesses, so that I don't give out any other information if I'm not supposed to?
Yes, ma'am. It's absolutely appropriate. That's what our health educators are doing. Our hotline, 336-318-6227. You've got my number. You call me anytime. Any of y'all know how to get us. But yes, that's what we're doing. We're spending a lot of time doing education and answering questions and providing. And Carrie, by the way, I sent you an email today, and you've got a lot of reading to catch up on.
I might
Thank
admit,
you.
the hotline people are fantastic. I've used them several times
Okay.
on stuff that was just so confusing the way it was presented. And they had the answers, or they guided me in the right direction.
Yay,
They're just absolutely fantastic.
that's good to hear.
And even though I'm working in Davidson County and working in Guilford County, I still call back to Randolph County
Well,
because I get
absolutely.
better answers here.
Well, I'm glad to hear that. That's good to hear. But yes, y'all please call us. Anytime you've got questions, call me. We had a situation today, actually. Pat Hurley, Representative Pat Hurley called me today, and she had had someone in the community who contacted her that was just so upset because their loved one was at a nursing home and they wouldn't let them in, and they were hearing from someone else that they weren't getting things they needed. And so I called, I asked her to give me the lady's name, and I asked Dana Wright, our nurse who's working with the nursing homes, to call her. So she called the person, got her concerns about her loved one. She called the nursing home. They set up a video conference for this family, between the family and the nursing home, and got all that worked out. So we do lots of things all the time. And they were very, very pleased because they could, that helped them be able to see their family member and know that they were okay, and they could communicate with them that way. So we are willing to do anything we can. Now, if y'all can do something about getting people to do what they're asked to do, because we're not doing a very good job on that account. But the other stuff, I think we're doing pretty good. So we're working really hard, and sometimes we feel like we're spinning our wheels, but we're still going after it.
Have you all seen any cases of any children, like middle school, high school, Randolph County, that have contracted
Yes,
virus?
I don't remember. I do too remember high school. Several weeks ago, about the time it was graduation, would have been graduation week, we had several young people who got coronavirus. They went to the beach, and a lot of beach goers. I think if you've got a house at the beach and you go and you stay at your house and you mind your business, I think you'd be fine. But the majority of folks don't do that. They're going with everybody, and everybody's having a good time. And so we did have some teenagers who, I know them, but we've had a number of children. We've had infants, we've had toddlers, we have not seen any severe inflammatory reactions so far in Randolph County from that, but that I can remember. We haven't had it. So
I was wondering how the Trinity Archdale area is, because it just seems they're so disrespectful. People don't wear a mask. They refuse to. Like Hillsville is just incredible how none of the stores wear a mask, none of the employees. And you don't know who to report it to, because then they said the sheriff is not going to enforce the mask or the sanitate. I mean, just all of that.
Well,
baffling.
Yeah, it really all goes back to all of this public health has no authority in
enforcement,
in the mask issue,
right,
or even who's open and shouldn't be. We've gotten a gazillion complaints about this gym or that gym.
Because people don't know who to call.
Say it again.
Because people don't know who to call.
Well, they call the hotline, and that's fine. We don't mind. That's what they need to do. But the problem is public health doesn't have any authority in that. And where all this started was our local DA said, I'm not prosecuting anybody because they've opened their business or because they're not wearing a mask. So local law enforcement has said, okay, then there's no need for us to go send our folks everywhere writing citations for this, because it's a class class 2 misdemeanor. But he's not gonna prosecute them, so local law enforcement has said, then there's no need for us to go. So it's not just, we've heard that from Asheboro City, we've heard that from Trinity, we've heard that or Archdale, we've heard that from Randleman, we've heard that from the sheriff's office. So it's not just one local law enforcement agency over another. They've been told, don't send anybody here because they're not following the rules.
I will tell you what I personally do. What I personally do is if I just see somebody going across the parking lot wearing a mask, I put the window down and I say, hey, thanks for wearing that mask. Appreciate that. I mean, it doesn't matter who they are, what color they are, what age they are. I just put the window down and say, oh, thanks for wearing that mask. I really appreciate that. And if I go in a business, I look around and they say, can I help you? And I say, well, I'm just looking to see if you're following protocol because I'm not coming in if you're not. So if citizens will do that, our money talks. And it says more than our law enforcement ever could. So when you go to these businesses where you see these things in place, if you've eaten at 2 or 3 restaurants where they do it right, then put that out there on social media. Tell your friends about that. Let those people at those businesses know, hey, I appreciate what I see going on here with the mask, your servers wearing masks, the social distancing, the way you've taken tables out, you know, the plexiglass at the register, all those different things. And I always make it a point to say that, to people, and then to spread that along, and then to, let that management know. So I think if we kind of get that movement going, I mean, like I said, I think money talks.
I think you're right. And it would be a daunting task to write tickets for everybody who's not wearing a mask. I mean, there's just no way.
Yeah, you could. You're right. There is no way you could do that. I would also say that I was in Randleman today for the going away luncheon for Zach, the city manager up there, and he's been there for 6 years and is leaving. And like all the servers, everybody working with it, they took your temperature and everything coming in. They were all wearing masks until you get to your table. Tables were spaced out. Seats at the tables were spaced out. Food was already in a box meal, so you just pick up your box and take it to your table. And so I appreciated that. I thought there was evidence that it had been planned very carefully and executed according to safety protocol, and I appreciated that. So.
Okay, anybody else? Well, I want to say thank you to Susan and her team as well, because they have done a tremendous job since, when did you go over there? Early March?
Early March.
So they've been at this for a good long while. I also want to thank Lynn for coordinating the goodies, the meal. We provided food for the EOC, the emergency services, and the public health department here. So thanks for Lynn and all her help pulling that together. Thanks for all you ladies who baked something or made something and sent that in. So we appreciate that, certainly. Lynn, if you'll make sure we get some information from you if we still owe you money, so that we can make sure that you get paid back, okay? All right. So anybody else have anything they want to share? Comments? All right, if not, do I hear a motion to adjourn the meeting? Robert, have a second?
Second, Hope.
All right. Courtney, how do you vote?
Say that again.
How do you vote on this? To adjourn the meeting?
Courtney Austin Wilson, aye.
All right, Robert,
Robert L. Brown, aye.
Mary Ann,
Aye.
Carrie,
Carrie Hampton, aye.
Hope,
Hope Haywood, aye and bye.
Julie,
Julie Mabe, aye.
Lynn,
I'm sure she said.
just nod, Lynn.
I
Okay, there we go.
did say yeah.
Okay. I don't see Ryan. Mac,
Mac Semi, aye.
Amy,
Aye.
and Marty Trotter, aye. So we are adjourned. Thank you for your time tonight, guys.
Thank you.
Right.
you.
Bye, everybody. Thanks.
Bye-bye. Wash your hands, wear your mask, stay 6 feet away.
Oh, I got it.